First of all, good morning and welcome to the second day of the IKCS North America 24. My name is Salvo La Rosa, and I'm the Chief Scientific Officer for KCA. Today, I'm very excited to give you a deeper understanding of the resources that KCA offers to patients and healthcare providers. I'll describe some of our data-driven program, highlights recent initiatives, and tell you more about new collaborations. Before I start, I would like to say that all our achievements are possible because of the support and commitment of our patients, caregivers, volunteers, and healthcare professionals like you here in the room. You play a crucial role in nearly everything we do. And I hope that learning more about this, learning more about our project will spark even more opportunities to collaborate. Together, we are united, unstoppable in our mission to support kidney cancer patients, ultimately to find a cure for this devastating disease. So let's dive into it. In 2024, we successfully launched for the first time 2 in-person patient symposia, one hosted at MD Anderson and the other in New Orleans. These events give local patients and caregivers a valuable opportunity to connect not only with each other, but also with their healthcare providers, fostering a supportive community and sharing insight into managing kidney cancer. With the positive response we received, we are planning to expand these in-person events to more locations. So if you're interested in hosting one of your institution, we'll be very thrilled to collaborate with you. Also, our virtual patient symposium has grown a lot. Thank you to your participation. We reached 350 registrations, and the content is now online and reaching even more patients. Being virtual allows us to connect everywhere, offering guidance on practical and essential topics. For instance, this year we address, among other topics, how to interpret your kidney cancer radiology report, how doctors decide on your treatment, and trying to explain to patients ways to optimize their kidney health after and during cancer therapy. This year also, we introduced several new patient programs to better support the community. One is the podcast designed by patients for patients, which amplifies the voice of patients. Not only, we also interview and talk to you, providers, and they all share their personal experience navigating the disease from multiple angles. We also created care packs that are available for free from our website that are intended to help them navigating and give them some comfort during this difficult diagnosis. And also we relaunch our private Facebook group. This group is dedicated supportive space for community to connect. And then finally, we collaborated with some of our partners like Respite Retreats, and we held virtual retreats. Those are aimed for patients that cannot travel, that are impaired or it's difficult for them. And this was a valuable experience for them to do an activity that was intended from the comfort of their home. Okay, moving on into research initiatives, we now offer 2 options to patients to contribute to research. On one end, they can donate their tissue through a partnership that we have now with Partner.org, which is an organization that is part of RCRF. They can basically sign a consent before they go to the operating room to donate their excess fresh tumor for research. And there are labs that already signed in. We can receive this tumor. The second is through a collaboration that we recently launched with XCures, and it's a participation they can do to their Excelsior trial, where they consent to donate their electronic health records for research. Patients can get access to their own data through this in a very organized way, so they gain the ability to see all of their data, but also their data goes into an aggregated, de-identified cohorts that researchers can use for analysis. So if you have an interest in looking in this data for some RCC or kidney cancer, reach out to me and we can work with them. And I'm excited to introduce you with the 2024 KCA Trailblazer awardees. This year we awarded $75,000 grants researchers whose project promise to drive impactful advancement. So 3 of these grants are in collaboration with some of the affiliate organizations, COA for a chromophobe grant, and Joyce Wink for a translocation RCC, and Corec Foundation for another project. These partnerships are essential for us to expand reach and impact in research, so thank you to all our co-founders. And next, I'm excited also to introduce our newest program, the KCA Mentorship Academy and the Dr. Nizar Tanier Rare Kidney Cancer Scholar Program. Congratulations to our 2024 scholars, and a heartfelt thank you to the mentors who volunteered to support this inaugural year. The program was made possible thanks to Pfizer and generous donation from Dr. Tanier that established an endowment that will support the Rare Kidney Cancer Program. Each KCA Mentorship Academy scholar received $15,000 grants for 1 year, along with access to a rich didactic lecture series in collaboration with the Academy from Brian Rini, and ad hoc opportunities with ACR and ASCO. Personalized mentorship further supports each scholar to strengthen their career and build a robust network, prepare them for be the leader in the field. So if you're interested in applying, the process opens next year in July. And if you would like to serve as a mentor, please reach out to me directly, and I will be glad to add you. Moving forward to our strategic collaboration, recently we launched and partnered with the Cancer Research Institute to co-fund a KCA CRI lab integration, clinic and lab integration program, or CLIP grant. This grant supports preclinical and translational research focused on advancing immunotherapy, specifically for kidney. The goal is to support qualified scientists who are exploring critical topics to optimize cancer immunotherapy. The grant offers up to $300,000 over 2 years, and letter of intents are due December 1st. So if you're interested in applying, please submit a letter. And you can see where to apply on cancerresearch.org/CLIP. Along the same lines, I'm glad to announce also a partnership to advance research that we are collaborating also with American Brain Tumor Association and a few others, cancer-specific organization for a CNS metastasis research grants. We can offer 2 of those, $50,000 to projects that advance the understanding of CNS metastasis. Again, here, time is critical. LOI are due December 17 if you're interested. Continuing on our collaboration, I'd like to talk about the KCA think tank meetings held on Thursday before the IKC conference. This meeting serves as key forum for global experts to tackle critical challenges and establish consensus and set research priorities. They provide a platform to discuss past really pressing issue and push forward advancement. Last year, think tank discussion by Pavlos Msal and Stephanie Berg explored the impact of post-progression therapies and on overall survival, and this led to a publication in Urology Oncology with all participants as co-authors. In Europe, James Blackmore and James Jones, sorry, that's the slide, you can see here the 4 major output. They basically contributed a consensus statement on digital pathology and biobanking in renal cancer, now part of the IKCS Europe Symposium proceedings. And looking ahead at this meeting and the past meetings, Michael Staeler and Lawrence Albiger are currently working on a manuscript on future research pathway for adjuvant therapy. While this year, Dan Shapiro and Marie Carlo are looking at biomarkers and methods of risk stratification to improve clinical decision. So all of these are like forums that are very, very important that I think will produce interesting outcomes. And we are constantly looking at ways to improve and to make IKCS meetings more valuable for researchers and the community. So that's why this year we launched the IKCS Conference Proceedings Series. This new initiative provides in-depth look at the research presented at IKCS and creates lasting reference also for the future. Our goal here is to, with these proceedings, to enhance research dissemination, broaden access to the important work being shared at these meetings, and we invite you to read our first issue and share some feedback. We want to make this useful for you. If you have any suggestion, we'd love to hear. And our next issue will be at this meeting organized by the KCJ. Last but not least, I'm excited to introduce our most recently, postdoc fellow program in collaboration with Tempus. This partnership provides our team with direct access to Tempus' vast clinical genomic database, one of the world's largest, containing over 100 petabytes of data and millions of records. This unparalleled resource will play a crucial role in advancing research aligned with KCA. So how is this going to work? We basically are collaborating with Justin Guinea, who is Senior Vice President, and we hired recently a postdoc on his lab, Nathan Molding. He was here actually at the meeting until yesterday. And the postdoc is going to be followed by experts in the field. We are starting with Pavlos and Elizabeth Hensky, Pavlo Musao and Elizabeth Hensky, who will co-lead the first set of research projects that will interrogate the Tempus database. This program will continue over the next 2-3 years, and we look forward to welcoming additional kidney cancer experts, keeping the collaboration dynamic and innovative. So if you have any question or any topic that you want to explore with the Tempus resources, please reach out to me. This initiative is also a testament to our commitment that KCA has to let our community utilizing cutting-edge resources and expertise to shape the future of RCC. So I hope this has given you the opportunity to learn more about our program, and really looking forward to, from you for new opportunities to get involved with us. And without further ado, I will move to, okay, this is done. I will move to a quick recognition that we want to have for our 2024 committee for the meeting. So I would like to welcome Gretchen Wagen, our CEO, and all of the committee. So Stephanie Berg and Jody Maranchi, the co-chairs for this year, together with Manoj Bhupati, Marie Carlo, Daniel Geisman, Philip Pierorazio, Sarah Tsuka, Youssef Zakaria, and Qing Zhang. So thank you for your valuable contribution. We'll take a group picture just in front of the podium. Thank you so much.
All right.